Good evening, everyone. Thank you so much for joining us. We are so excited that you decided to take 30 minutes out of your schedule to come spend that with us and just hear this amazing testimonial tonight. I'm super excited about it. I'm Nikki McCutchen. I will be your host. And just know whoever invited you to this call tonight must really care about you to want you to know about this technology and know what it can do for you and your friends and your family. And just to get to hear this amazing story. Like I said, the call will be for 30 minutes, and we just want to start with our medical disclaimer. Tonight, what we will be sharing is for informational purposes only. All LifeWave products are not intended to treat, cure, diagnose any disease. If you're on medications or have any medical conditions, please, or pregnant or nursing, please check with your physician first. So, with that, I am so excited. It is just going to be such a pleasure and a treat for you all to get to know my new friends, Steve and Kathy Boyles, Dr. Kathy Boyles. And just their story is absolutely phenomenal. So I am going to let you guys take it away. If you will come on and just tell us how long you have, well, let's start with why you decided you wanted to use the technology.
Okay, well, I don't know, about 6 months ago, we were out to lunch with some friends and after church with our church group. And one of the guys that was sitting next to us was talking about the patches. And I don't think he'd actually ever used them. He was just talking about them. And so I was trying to figure out for the last 6 months how to find these things because I didn't really know anyone that was, a brand partner or anything like that. And so Kathy was at a holistic a wellness show a couple of weeks ago, and Nikki had a table just right across the way from us. And I was going to go around and look at everybody, but Kathy said, "Why don't you go check that out?" Because Nikki had a sign that said "activate stem cells," stuff like that. Well, I'd done a lot of stem cell investigation in the past, and it was all real expensive, and it was kind of hit and miss whether it works or not. So I thought I'll go check it out, and she had quite a few people sitting there talking to her. So I finally got in there and started talking to her, and it sounded like when she started telling me about it, I thought, oh, this is the same stuff my friend was telling me about it. So I put a patch on, and I didn't really notice a whole lot that day. But when I woke up the next morning after wearing the patch all day, I felt like I had like a ton of energy all day long. My thinking was clear. I was, felt motivated to do a lot of things, and that's not typically all the way I always feel. But normally in the middle of the day, or about 3 o'clock, I might want to lay down or something, just take a rest. I didn't feel like that at all. So, and I had talked to Nikki, and I said something about, well, I might try these for a little bit, and then if I like them, I might talk to you about more detail about it. Well, then I guess that was on a Sunday, and then or on the Saturday, and then Sunday I felt great, and then Monday I contacted her and I said, "Hey, I'd really like to see if I could get some more of these patches," because I had ordered some at the show, but it was going to be several days before they came in. And so I met her. She gave me some, and she gave some for Kathy to try. And then Kathy wore them and got rid of some pain she had. I wore mine and was still feeling great. And I've been on it for about 2 weeks. And so basically, in 2 weeks, I've not had any slow days where I didn't feel like where I got tired and all that. I've had plenty of energy. I've slept great. I've started dreaming again, which I haven't been doing in a long time. I just feel great. And I think I had a list of things I was going to say. Now I can't remember them all. But anyway, and then I ended up telling Nikki that I said, "Hey, I want to be a brand partner because I really believe in these things because they're really helping me. They're helping Kathy." So I'll let her say something now. Go ahead.
Well, the reason why it's significant for Steve to have energy and everything goes back to our story, which in December of 2021, Steve's reasons, unfortunately. So that was kind of my wake up call to look at things and see the dark side of my profession. So now that I've seen that, we are kind of looking for more holistic ways of staying healthy. And Steve still had a lot of recovery to do when he came out of the hospital. So he has taken quite a few supplements in the last couple of years, but still, kind of had the residual tiredness and trouble with his knees sometimes. And so, it's only been like, I don't know, a week and a half or 2 weeks that we've been using patches, but he is feeling a lot better already. So that's, to me, a really good sign that he's on the way to, getting back to normal totally.
Absolutely. Yeah, absolute miracle, just so amazing. And so, Dr. Kathy, tell us what you noticed when you decided to start using the patch as well.
So for me, mostly, I guess two things. One is that I often have pain in my left shoulder and back, and so that's been a lot better. And then just having more kind of alertness and feeling like my mind was nice and clear. That's been a really good thing too. So I don't think I've done it as many days as he has, but
I don't think so.
we're just kind of in the beginning stages. So I'm sure as things go on, we'll notice more and more. But just kind of the initial things, it's more energy and focus and just pain relief.
Oh, one other thing that I noticed is that I I I haven't got to work out on a real regular basis, and usually if you work out after a long layoff the first time back, you're kind of sore and not feeling very good and don't have a lot of energy maybe. But I worked out yesterday. I wore the X49 patch, and my muscles felt great. I mean, I haven't had any achiness or anything like that. So I was real happy about that. So that I'll just keep working out and wearing those little patches.
Absolutely. That's awesome. Yes, because when you haven't worked out in a while, especially after everything you've been through, and then you go back to the gym, it is usually a very painful experience. So that's pretty impressive.
Yeah, I was real happy with I was kind of anxious for order to come in to get the X49 because I really wanted to try them out. And so now that encourages me to keep going back and getting more exercise. So
Absolutely. You don't have the deterrent of pain and lactic acid buildup to try to convince you, oh, I'm going to wait a couple more days.
yeah, no, I don't have that excuse because I don't have it. So
Right. That's pretty amazing. Yeah. And I just think it's such a credit to you guys and and to you, Dr. Kathy, all of the work and the research and everything that you've done to just help Steve to heal because again, even though, all the things that you were utilizing, because didn't you tell me you did hyperbaric oxygen, you did some things like that along with the supplementation?
I did. We know some people that have a hyperbaric chamber business, and they were gracious enough to let me use the chamber quite frequently to help my recovery, which I believe really did help. And plus, they had a big red light table that I laid on many times. But I can tell you the patches are much more comfortable than laying on a cold, flat, hard red light table.
Yeah, it's pretty uncomfortable. I did it one time, and that's about all I could handle was laying on the hard table once.
Yes. Yeah, we were talking about that the other night, and so that was so interesting too because we were talking about the fact of you're laying on this really cold hard table for a while, and so that's like getting across your whole body. And when we first met, you're asking me, okay, I don't understand how this tiny little thing can make everything in my body work because normally I have to lay on that table, and I don't want to do that again.
Exactly. Yeah,
Yes.
well, you can only do the red light table for 30 or 40 minutes or something like that, and you wear these little patches for 12 hours. I think you're getting a lot better treatment with the patches. Although I'm very grateful for my friend who let me borrow his red light table and his
Yes.
just the patches are a little more convenient too. You don't have to go anywhere. You just wear them.
Absolutely. Yeah,
Well,
and all of the Go ahead.
Oh, I was just gonna say, I think, you know, Steve's taken for the last 2.5 years, he's taken a lot of supplements. And so he does have a lot of substrate, and being on some good quality supplements, I think and then adding the patch on top of that really just kind of packed a punch, because that is why I think he's starting to see results so fast, because his body already has stuff, but then the patch just actually gets his stem cells to go out and you know, do the work. So
Absolutely. Yeah. And all those modalities are fabulous. And I just, like I said, I think it's such a credit to you to be able to, do that research and see that there were these other options. And the fact that as a doctor and all your information and degree and everything that you know, to even be willing to look outside of what is actually out there. And I just think that's such a huge credit to you, because, I forget, how many years have you said you're a pediatrician that you told me?
32.
32 years. So I
Yeah, I
mean,
went
I
to
just,
medical school when I was 10.
when you were 10?
No, she's
No, I'm
joking.
just joking.
She's joking.
I don't want you to count up the years.
I was totally gonna believe you. Like, okay, now
No.
see how crazy I am. I'm just gonna believe you. That's awesome. No, I mean, it just is such a credit to you to be open to learning, outside of your profession, because I think so many of us, not just doctors, but so many of us get stuck in. Sorry, I must have hit the wrong button. We get
Oh,
stuck in, oh no, I'm not muted. We get stuck in what we're used to, what the knowledge that we have, and we just, stay there versus, learning about all these other things that are now available to us. So, oh yeah, so Margie's saying Dr. Boyle looks amazing. Yes, that's awesome. You do look amazing. So we're just excited for you guys, and your story is just inspiring. And like you said, the supplements, being able to take those supplements, and they support our body as well. So having those nutrients, and it wasn't just a little bit of supplements. Why don't y'all kind of share with us, when we get in these dire straits, there's a massive amount of things that sometimes we have
Um,
to do. So
so let's just say that the nutrition in the ICU is not ideal. Steve had a trach and a G tube, and when you're in the ICU, let's just say they like to put a tube in every orifice. And so it is really a horrible situation for a loved one to be in that situation. I mean, I have been on both sides of it now, and I definitely don't like the patient side of it one bit. So um, he had lost quite a bit of weight. I don't know,
40 pounds.
30, 40 pounds.
40 pounds.
And it was all muscle that he lost, because those G-tube feedings that had a friend of mine recommend someone. So we went there, and this guy got Steve on so many supplements that Steve was taking 60 pills a day,
So
30 in the morning and 30 at night.
that was my breakfast and my dinner.
And I made sure he took every single one of them.
yes.
And so he was pretty compliant with it. And then, we've been able to cut back on a lot of them. And then, he's hoping that he can wear more patches and take less pills. That's, I think, his number one goal. Wear patch and don't take so many pills.
Yeah, I'm down to 11 pills in the morning and 11 pills in the evening. So
That's awesome.
that's much more bearable. I can actually feel like eating food now, because when I hadn't eaten a lot of food, so when I take all the pills, I didn't feel like there was a lot of room left in my stomach to actually get any real nutrition, real food. So
Well, I don't know if you realize how bad glutathione actually tastes if you have taken internally. So that little patch that I've seen, I haven't tried it yet. So maybe you have some people that have tried it. But the
it tastes off.
the glutathione, it's a hard supplement to get absorbed. So you have to have a liposomal form of it, which is best given as a liquid. And so I had a supplement. These are all nutraceuticals, so they're very high quality. but I had one that was this yellow liquid that really tasted awful. He would take it and make faces. And then I tried to get my daughter to take it and she would just not do it at all. And so seeing this as a patch, it was like, oh, glutathione patch. Yes, we can do that. We don't have to take nasty liquid.
Awesome. Yes, that's awesome, and elevates your glutathione by 300 times versus having a 7-minute half-life. So, yes, very
Right,
much far
right.
superior to the liquid glutathione for sure, or IV glutathione for that matter. That's super exciting. So, Dr. Kathy, I want you to, so if you have kids and you are in the Tulsa area, I want you to know about Dr. Kathy's Freedom Pediatrics, where she is a pediatrician, a functional medicine pediatrician. If I had kids that were little still, I would have given anything to have a pediatrician like Dr. Kathy. So why don't you tell us a little bit about your new practice that you're opening up?
Well, I'm in the process of setting up my electronic medical record. So I will put my contact in the chat.
Perfect.
And if you are interested, functional medicine, is that right? freedompeds.com, right?
Yes, yes, yes.
Functional medicine is root cause. So that means that instead of treating your ADHD with amphetamine controlled substance, which is a stimulant, we would get to the root of the problem and increase your own natural dopamine, which is what kids who can't pay attention are low in dopamine, because dopamine is a neurotransmitter that helps you focus and scenes. There's a lot of reasons why they can have neurobehavioral problems. So getting to the root cause of it, which is testing that we can do, and then intervening biochemically at the point where we need to intervene, depending on, if you have a problem with one of the enzymes in a pathway or something like that. So that's kind of what that is. I think the patches will kind of accelerate a lot of the things that we can do functionally with supplements. So that's kind of what I'm seeing with Steve and what's happening with him.
Absolutely. I mean, y'all, are you excited about this? To get to hear these stories that we're going to get to watch Dr. Kathy help so many kids. I mean, it actually makes me want to cry. I mean, I'm so excited. I love being able to help kids that are going through tough things and families that are going through tough things. And that's been one of the highlights of getting to watch some of these mamas who've chosen to use this technology with their kids and just see the results that they have had. And so to get to hear some of these things that are coming down the pike for you, and we're just going to get to be a part of it and watch it. I'm just so excited. So thank you all so much again, like I said, for being open. I know it was a really long road, a really hard road to have your eyes opened, Dr. Kathy. But I know you didn't share about it, but just so you all know, I'm just going to throw this out there. They've written a book about their journey with everything that went on. It will probably not come out until next year, but we are all going to be super excited to get to hear about that book, hear about what the Lord's done, how he has blessed you all. And I'm just super excited about everything that he's going to do through you guys now. And even though taking you guys through that really rough time, he just works amazing, miraculous things.
Amen.
Sorry, I'm
Yeah,
such a crier. I'm so excited. Yeah, I'm really excited for you guys. It's really cool.
I'm gonna put whoops, that didn't come out right. Heaven's Messenger, there's no space. That's our website. If you are interested in our story, because Steve had a supernatural experience when he was on the ventilator. So that is our website. The book title will probably be different than that, but that has interviews that Steve did with a pastor friend of ours after he got out of the hospital. And you'll be able to see the difference because he looks a lot better now than he did when he first got out. Although he was walking and talking, and that was good, but, you know, yeah, just if you're interested, you can watch the videos on the website and read about us there. So
And hopefully maybe one of these days we'll update it. It hadn't been updated in a while, but it's a good start anyway until I can update it some more.
or until our book comes out, we're working on
Yes.
things
Yeah.
with the editors now.
Absolutely. Yes. Thank you for sharing your story and going to the trouble of putting that out there so people can hear about it. And it's just amazing. You're both just walking miracles in my mind, just because of every thought process that you had to overcome, Dr. Kathy, to get you where you are today. And Steve, just the Lord clearly has big plans for both of you, to allow you to, keep you here on this earth, just to proclaim his name and point people to him. So I just think it's really cool. I'm super excited. I'm super excited for you all. With that, I do need to explain. We just have like 1 minute. I'm going to go over that just a little bit, but just to tell you about this technology, and really because Steve's body was so well supported with all of the hard work that they did, of finding a great chiropractor who uses all kinds of nutraceuticals and help and support the hyperbaric oxygen, the red light therapy. All of these things can support our natural body processes. And they were already doing that. And then enter the patch, hence why Steve just gets reaction in 1 day of noticing things and change, because his body is already working and being supported in all of those natural ways without all the things that can get in the way, and all the toxins and all the medications and all the things that can shut down and slow down our body. So these patches, this technology is completely non-transdermal. It all operates through light frequency. It's sealed on both sides. Nothing transfers from the patch into your body. It's completely sealed and non-transdermal. It works through a process called photobiomodulation, and that's just a big word meaning light making change in the body. We emit a low-grade infrared light, and that light is reflected from the patch back into our body, turning on specific peptides, telling them to work the way that God designed them to. So you can actually wear this patch anywhere on your body. We do have over 90 clinical studies, over 150 patents, and you can look at all of those on patchtheway.com. If one of you will put that patchtheway.com in the chat, that is our amazing website that we have, where you can find all of those clinical studies and patents, as well as some more excellent videos that are there. We recommend you wear the patch 12 hours on to activate and repair, and 12 hours off to give your body a break. Because what happens is when you are constantly telling your body to work, because it's getting that signaling from the patch, your body says, okay, I need a break. I'm going to get tired out. Just like when we go to sleep at night, it's time for our bodies to rest, repair, and rejuvenate, to detoxify. And that same thing happens with the patch. So you take that patch off so that your body can have a break. The next day you put on a brand new patch, and then your body gets to work again, signaling those peptides to go and do what they were designed to do. The specific peptide that X39 activates is called GHK copper peptide. This amazing peptide does so many things, but just to give you a quick list, it activates dormant stem cells. It supports your cardiovascular system at the mitochondrial level, everything about your cardiovascular system. It supports wound healing and collagen production. So not just hair, skin, and nails, but from the base, 19 different types of collagen we have in our body that are all then supported when GHK is activated. Your immune system. It helps to support your immune system. So when we have those things supported in our body through GHKCU, any amazing miracle can happen. And that's what those of you and I that have been doing this for a while now get to see all the time and experience. And it's why when we meet new people, and we meet people that have this great influence and want to help children, it makes us so excited, because we know what they have in store for them in seeing what this technology does, because we've been seeing it for a while now in people. So we recommend that you wear this technology 1 month for every decade you are old. If you're 50, that would mean you need to wear it for 5 months to really see what it's going to do for your body. As you wear it longer than that period of time, it begins to have a compounding effect. So more and more dormant stem cells get active. More and more things get rejuvenated to a younger, healthier state. So it is truly a miracle that we have this amazing technology. The only thing close in comparison is stem cell injections, and they don't do all the other things that I listed out, and they don't even always work, and they're thousands and thousands of dollars. And this is pennies compared to that. So with that, I know I am over time, but Steve and Dr. Kathy, thank you so much for coming on. Thank you for being willing to share this with the people that you know. We are super excited to see all the people that are going to be blessed. And we just please get back to whoever invited you to this call tonight. Tell them that you want to get started on the patches today. Place your order today with them, get started. And then come back and tell us what is going on with you, what you are seeing is happening with you. I would love to interview you in the same way and get to hear all the amazing things that are happening with you as well. So we do a Saturday night call that's coming up that will go over, Ed and Vicky do that. It'll go over all of the patch technology we have, as well as the business opportunity if you're interested in that. I will be back on next Monday night, just doing an X39 review. It's the perfect time for you to come on and invite the people that you know, because I will also answer questions. And some people will come on and tell stories of things that they've seen. That's again 30 minutes. And then we'll have our whole weekly schedule again. Wednesday night, we do a business call. So we would love to have you all on for any of those. But thank you again so much for joining us this evening. Thank you, Steve and Dr. Kathy. And we pray blessing over each and every one of you. Good night, everybody.
Good night.
Good night.
Thank you
Thanks
for
for sharing. Good night.
Thank
God
you.
bless.
Thank
God
you.
bless.
God bless you.
Good night.